And we are back again. Fasting during Ramadan is obligatory for every Muslim who is able to do so. The fasting hours vary from year to year depending on the season in which Ramadan falls, but they are usually between 11 and 18 hours of fasting. This poses a dilemma for patients who take the medication in multiple doses and at close times. And patients' fasting depends on the opinion of the doctor who is taking care of their health condition. Let's know more about that from our guest today about the nature of taking medications in Ramadan. We are pleased to have with us today Dr. Latifah Alshuwaie, clinical pharmacist at Al Amiri Hospital. Hello and good morning, Doctor.
Good morning, thank you.
We are glad to have you here in the show, especially me, because this is a very important issue. As you know, taking the role of the pharmacist in terms of advising the patient to how to take the medication, when to take the medication, and is there any harm to take the medication? Could you tell us about that?
Okay, first of all, the main factor that considered before prescribing any medication to the patients, that what the drug does to the body and what the body does to the drug. So we have to consider that before giving any of the medications. Our clinical pharmacist, or we are considered to counsel the patient why he take this medication, how to take this medication during Ramadan or after Ramadan, and we have to make sure that the patients and their healthcare giver or their family understand and fully understand how to take the medication, what the possible side effect of the medication, and how to deal with the side effect during Ramadan.
Yes.
So this is our responsibility.
Yes, but of course, people will be people, right? They will do whatever they want. They will take the drugs. They say, yeah, I'm fine, I will take it.
Yes.
But now in this interview, inshallah, we will provide some insight about medications and how they are contribute to the overall health. So now, multivitamins.
Yes.
If someone is going to take it during Ramadan, and by the chance that this multivitamin will make me don't need to eat the foods, so all what I need in this medication. Let's talk about the medication, the supplement in the multivitamins.
For my point of view, first of all, patients has to know if he really needs these multivitamins or not. The reason of that, because some of the multivitamins will interact and impact the absorption of the another medications. So, and these multivitamins must be prescribed under the supervision of the doctor. So it's very important to know if the patient needs these multivitamins or not. This is the first thing. And if he really needs this medication, so this medication can be taken after iftar or after suhoor. So there is no time depending to take these multivitamins.
Is it okay to take all the medications, the supplements, let's say, omega-3, multivitamins, and any other herbs in terms of, can we take them all at once? This is my question. When I said in the first interview,
no, it's better to divide it, to separate the medication. That I said before, that there's some of the medication will interact with each other, even the food. There is a drug-drug interaction and drug-food interaction, and it is the supplements. It may interact or impact the absorption of the medication. The doses may be increased or decrease the effective of the medication. So it's better to separate the medication. For example, I will give you a medication that is used to treat a thyroid medication, for example, levothyroxine or elytroxine. It will be impact if the patient take any of the iron supplements or the calcium supplements that reduce the absorption of this medication. So in this case, if the patients take this medication with these multivitamins that may the doctor need, will be increase the dose, and it's not necessary to increase the dose. The reason of that, because the patient take this medication together. The medication, thyroid medication, must be taken in half an hour before food. And it has to be separate at least 4 hours between the thyroid medication and these supplements. So this is the main important thing, to separate the doses of the medications.
You mentioned drug interactions.
Yes.
Right. Toxicity. Yes. This is a very dangerous thing to happen in the body.
Yes.
So toxicity, drug toxicity.
Yeah.
This is something we can be scared of. But can we do it? Can we be take the this risk from even just the medication that the doctor that already prescribed for us, and just take them at once?
Yeah, it's very important to know what's the drug toxicity. Drug toxicity means that when the drug concentration in the blood is above or exceed the therapeutics range. And there is some of the medication is called a neurotherapeutics index. That means there is no differences between therapeutics and the toxic drug. So in this case, our rules to know or review the whole medications of the patients and consult them what's the factor that may increase or decrease the concentration of the blood, decrease the concentration of the drug in the body. So it's very important, and it's our rules to ensure that the right dosage of the right drug reach to the right patient, by the right time at the right route. This is the main important rule of the clinical pharmacist or the pharmacist, to ensure that the patient receive an optimal drug and know how to use the medication and how to avoid the possible side effect of all the medications.
These are really valuable information, especially for the elders. Now let's talk about antibiotics.
Yes.
If I am sick during Ramadan, some people will say, I want to fast. I want to fast, but the antibiotics, they have a time, certain time.
Yes.
Also other medications for the heart. And how can we manage these time?
Okay.
Can we shorten the 10 hours? They are all 12 hours?
Regarding the antibiotics, there's three differences of the antibiotics. For example, the antibiotics is take once daily, so it's very easy to take it just after iftar. There is another antibiotics is taken twice daily, so it's better to take it after iftar and after suhoor. In case of the antibiotic that usually taken 3 times a day, it should be every 8 hours. In this case, in my opinion, the patient must consult their doctor to find a suitable alternative of the medications, or it's actually the antibiotics will be taken for the 5 to 10 days if the patient be able to be fasting, so he can fast and take the medication as being prescribed, and if he cannot fast, so he can break his fasting.
For a few days. Now let's talk about if you have any advice for the diabetics. Diabetics need to take insulin, and they also have the time, and maybe they will have a risk health condition during Ramadan. So any advice for them? Especially
for the diabetic patient, either type 1 or type 2, he has to see his doctor before Ramadan. The reason of that, because the doses actually for the oral antibiotic and insulin is depending on the meal size and the type of food that the patient eat. And and also there is the most important blood test should be do it before the Ramadan, which is called HbA1c. It shows that how the blood glucose is controlled within 3 months. For example, there is some of the medication is take once daily, so it's better to take it after iftar to avoid any further complication of the hypoglycemia or hyperglycemia. The rest of medication, it may take it twice daily, so it's better to take it after iftar and after suhoor. One of the medication, it may take it 3 times a day, so in this case, either the doctor can adjust the dose to twice daily, and it actually is based on the doctor opinion and the patient condition, or the patient can take 2 doses with the heavy meal, either it's suhoor or iftar, and the second dose can be taken in suhoor if it's a light meal. Regarding the insulin, it's very important to consult patients how to deal with the doses of the insulin, because we have a short-acting insulin or rapid-acting insulin that it's working within 30 to 60 minutes. Some of the patient inject himself and forget to eat, or just take a break his fasting with the dates and water, which is very dangerous. The patients who take a rapid-acting insulin maybe eat they have to eat immediately after when he injects.
Why they are not eating after injecting? Because they feel.
It's based on the patients. Maybe like I'm full with eating. We have.
This is why people take these injections to lose weight.
No, this is a difference.
Different.
Different. Insulin is different with the injectable anti-diabetic. This medication is used. It's really used to treat type 2. Actually, type 2
Type 2
diabetes.
is less dangerous, or is it the same but curable? Because we don't have the information.
The type 1 is different from the type 2. Type 1, it must be treated with the insulin. Insulin, which is rapidly reduce the blood glucose. If he missed the dose, the blood glucose will be higher. So we have to consider the risk and benefits of this medication. The Ozempic and Mounjaro is the difference. Is not dependent on the meal size.
We have to mention it.
Yes, it's very important because most of the people use it.
Yeah, they use it for other reasons than to be healthy. They want to look perfect. So let's talk about painkillers. Now let's talk about this very important subject. It has a lot of risks to the body, especially in large doses.
Yes.
A lot of people take it not because they feel pain, but to feel something else. So now let's talk about the dangers of painkillers if you take it in large doses.
Yeah, actually some people think that the painkiller is safe, and it is not. It should be, and it must be really, it must be prescribed by the doctor. That the large doses of if the patient exceeds the maximum dose of the painkillers, for example, ibuprofen or ketaflam, it may cause a serious side effects really. Even if the patient take the recommended dose, the main side effect of this medication is the nausea, vomiting, gastric pain, GI bleeding, stomach bleeding, which is a serious side effect. And also this medication or this painkiller, if it's taken more than a regular, it may impact the kidney function, even if the patient is an older adult or the patient with a chronic kidney disease. As well, this medication may cause water retention and increase the level of case hypertension. The patient with a cardiac disease may impact their condition. And also the paracetamol, which is the Benadryl, everyone uses this medication. A larger dose of this medication may impact and cause a liver toxicity, which is a serious condition, and some patients need to be admitted in the hospital. So very important to counsel patients how to use this medication and how to deal with the side effect.
Yes,
so it's very important to know.
Yes, also it will affect the brain, the painkillers.
Yes, the opiates, the strong opiates, it may affect the brain and may cause dizziness and serious side effects.
So those with the chronic disease, and when they take the painkillers, and especially when they mix it with other medications, it's really this variety of medications, and if we talk about them and combine them, we talk about interactions, it's really dangerous.
Yes.
So we need the clinical pharmacist or the pharmacist to tell us about how to take them step by step, or else it can be lethal.
Yeah. Some patients think that it's just a painkiller. I will take 1 dose or 2 doses, but it's actually it will impact the patient's conditions, especially the patient with a chronic disease. For example, patient with a cardiac disease like a hypertension, heart failure, and etc. And also the patient who has a problem with their kidneys. It's very important to counsel patients what the best painkillers that he has to take him based on his or their condition. So it's very important to counsel patient, and this is our rules that I mentioned before, that we have to know and we have to counsel patients about the optimal medication that he can take it.
Yes.
Like I said, like there is a drug-drug interaction, a drug-food interaction. Even if it's a painkiller, there is a serious interaction with another medications.
Now we reach the end of this interview, but I have a question for me. Interactions.
Yes.
Now it's not a medication, it's a supplement.
Yes.
You know, when I take multivitamins with omega-3, I take a lot of things with it just for the well-being, right?
Yes.
Ashwagandha and these herbs. You smile. So all of these will interact Even so, even though it will be safe, right? Because they are herbs.
It's herbs, yeah, but if you don't have any health problems, so it will be safe for you.
I drink a lot of coffee, so since we have
it's the caffeine also. It's
I drink a lot of coffee, but I take the ashgawadda to make me feel relaxed. So is that fine?
It will be fine because that I said you don't have any other health, any problems, any medical problem. But the patients, when he reads that these herbs it will be useful for the blood glucose, and he ignores to take their medication, it's very dangerous. If you wanted to try anything, if you wanted to take any of the multivitamins, you have to consult your patients or the pharmacist if it is suitable for their cases or not. So my advice to consult your doctor, consult your pharmacist for your life.
I just consulted you, Dr. Latifah. Thank you so much. Thank you so much for coming to Mudonah Kuwait.
Thank you.
That was Dr. Latifah Alshuwaie, a clinical pharmacist at Al Amiri Hospital. Now we will continue Good Morning Kuwait, but after this break, stay with us.